Hello and welcome back to another episode of Let's Learn PT. Today we're going to be discussing another differential diagnosis and going over two different ligaments of the knee. As always, this is not medical advice. If you need medical advice, pursue a licensed practitioner. This is merely for educational purposes only. MCL versus LCL. So our MCL is our medial collateral ligament. It connects our femur to our tibia, our medial femur right here, down to the medial aspect of our tibia. Some of the deep fibers of it run into the medial aspect of the joint capsule and connect to the medial meniscus. But its main job is to resist valgus medial force. So meaning if I had somebody who fell into the outside of my knee and crashed my knee inwards, the MCL is what's designed to control that force and prevent medial injuries of the knee. So the way in which we can tell if the MCL is intact and functioning well still, if somebody has a medial knee injury, is a valgus stress test. A valgus stress test is having somebody with their knee slightly bent, providing a lateral force to stress the medial aspect of the knee. As I push on that lateral aspect, the medial aspect will give me a good idea of how much give and joint laxity it has, and then give me a good idea of the condition of the MCL, the medial collateral ligament. The LCL, on the other hand, is the lateral collateral ligament. It is a ligament on the outside of the knee that connects the outside of the femur to the fibula. What it does is it resists medial force, meaning that if somebody were to crash into the medial aspect of my knee and stress the lateral aspect of my knee, my LCL is what makes sure that I do not have an issue with the lateral aspect of my knee because of that stress. It, like I said, resists lateral varus force, and it is outside of the capsule. So that varus stress test, similar to the valgus stress test, just the exact opposite, is how I would detect integrity of the LCL. So I would provide that medial force and I would see if there is joint compromise and laxity on the lateral aspect of the knee. Both of those tests are not hugely specific or reliable, but are a good test you can do in clinic to detect medial or lateral instability of the knee, especially prior to an MRI. Both of these ligaments are vascularized and usually can heal, typically if it is a grade 1 or 2 sprain. If it's a grade 3 sprain, oftentimes surgical management is needed. And they work together in unison to control medial lateral force at the knee. As you can imagine, as I'm running forward or I'm shuffling laterally, any of those things, I need those ligaments to function properly to control the medial lateral forces that are at play when I'm moving. Then I want to go over grade 1 through 3 sprains. A grade 1 sprain would be mild tearing with minimal instability. So if I was doing my valgus stress test and I was providing that lateral force to see how the medial knee is, I would notice that there's a minimal degree of instability, meaning that it has a little bit more give than usual, but it's clearly not giving out completely. So that would be more indicative of like a grade 1 sprain, and these are all things that would be confirmed with MRI. A grade 2 would be moderate tearing, where I note a good deal of instability. So if I'm doing a varus stress test, I'm pressing and I can really see the lateral aspect of that knee. I can feel it kind of give and have a degree of laxity. That would be more of a moderate tear, noted instability with a varus stress test. And then finally, a grade 3 is a complete tear, where if I'm doing a valgus or varus, I'm giving that force and then I can really feel that knee give way, like there's not much of any ligament holding it and providing the stability it's meant to. So that is an MCL versus an LCL. As always, thanks for watching. Give me a comment. Let me know if there's anything you guys want me to cover. As always, I appreciate it.